Prof, thanks so much indeed for joining us. Let's start by trying to assess the kind of leadership and response that the big nations of North America and Europe have had on this COVID-19 pandemic. It seems it's been at varying degrees of success, and some might even say failure.
Yes, what we have observed is that both the countries of North America and of Western Europe, which we collectively usually call the West, did not give the incidence of this pandemic the requisite attention it needed at the beginning, especially toward the end of January, to enable them to act with speed, with determination, with clarity right at the beginning, in order to prevent it from running away as the way it did, because as we know, the virus has a 2 weeks incubation. The actions we did not take at the end, the actions they did not take at the end of January, were seen in the result in the test results of the middle of February. So there's a 2 weeks lag. So the fact that some countries, such as the leaders of Britain, of the U.S., and others, thought this was a hoax. It was really just a Chinese disease, and they continue to think of it that way. It's just a Chinese disease. It's just going to end in China. It is a local incident and stuff like that. Or assumed, as in the rest of Central Europe, that their systems are so advanced and are so well developed, of universal health care, so they are unlikely to be hit by the diseases that are associated with countries that are developing, that have less developed health systems. And because of that attitude, they were caught napping, and by the time they escalated their responses at a political level and also the medical level, they were already dealing with epidemics in their own countries.
All right, how have they done since then? I mean, now we're in the midst of it. America in particular, now the owner of a third of the global problem in terms of deaths and record numbers of infections. Has politics also played its hand?
What we did see is that when the epidemic started to show in both the numbers of infections and the numbers of deaths, and these countries started to act with great vigor, beginning with Italy, and very immediately, very close to Italy, Germany, though it did not have a huge incident, but they had the wisdom to act as if they had a huge crisis. And that's the kind of style of leadership, political leadership they had. The leadership that is thorough, the leadership that is led by evidence, the leadership that is led by an interest in securing the lives of people. So you could see that in very clear ways, that they're moving very quickly. Britain continued to slag, even as the crisis set in and the figures started to pick up. And their prime minister continued to say that he's going around hospital, he's shaking hands of people, all this is okay and it's fine. Boom, he gets infected himself. So what we have seen is that we have seen different kinds of politics, serious politics, taking this thing very seriously in countries like Spain, like Italy, like Portugal, and Germany, and countries that are kind of continue to lag, like Britain and the U.S. The U.S. is a completely different story because the U.S. acted very quickly, actually acted in an exemplary way, when it stopped the flow of traffic from China right at the end of January. But it did that good action, and it did it for a wrong reason. It did not do it in order to curb infections. It did it in order to convey geopolitical messages to China, which is why they did not stop the Americans coming back from China, from coming into the U.S. in big numbers, with very little testing, with every monitoring, with very little anything being done at the port of entry, because these were our citizens. So they did did very well, but they did it for a wrong reason, and it hit them badly. Now, as you say, they have very huge figures, and they have a huge crisis in their hands, and they don't seem to even be taking it seriously now that they are also reopening their economy at a time when the crisis is at its worst state. They have the worst debt, more debts than they had during the Vietnam War. So it is a huge crisis, but the leadership is not taking it as seriously as it is, again, because of the politics. And the politics, again, in this particular case, are also about the November 3 election that Trump needs to prepare himself for.
All right, let's come back home to our continent. South Africa has been widely lauded for its efforts in combating COVID-19, even though we're one of the countries with the highest numbers of infections. How would you rate the continent generally? Because there are a few really good cases of how to lead during the time of a pandemic on the continent.
Of course, if you take the South Africa story out, because it's now very well known, you look at how Senegal also acted very fast to increase the amount of testing and monitoring, contact tracing. They also moved very quickly into the research side, participated in a multinational project to try and find a cure and find a vaccine. And we saw also in Rwanda, they acted with great speed. They had very, very small number of infections, but they acted as if they were in a crisis. As a result, they were able to turn the curve downwards. Now the curve has really turned downwards, and a lot of things have worked. And they did that with great order and great work. And then we'll have a case like Tanzania, where the president said you could close everything, but you won't close the church. Because we need the church. So they allowed some element of opportunities for infections to grow. Because it takes 2 weeks for the results to show, we are beginning to see their numbers growing very quickly right now because of the decisions that they took. And one of the most fascinating things, Peter, about what we saw in the continent is countries where leaders go outside their countries in order to get cured when they are sick. Here they were, some senior figures in Cameroon, some senior figures in Nigeria, for example, and a few other countries who got sick but could not go to Europe because Europe had a crisis of their own and would not let anyone come in. Now they were forced to face the state of national health and go and seek their help there. It's just said that one of the senior officials in the president's office in Nigeria had to pass away. But one hopes that they learned their huge lessons that charity begins at home. They need to build health systems at home.
Do you think that Africa has done well to work together, a coordinated effort? I mean, there have been some great strides made in making sure that there are testing centers across the continent, and the continental body has been working in terms of making sure that under-resourced countries get assistance. Do you think that when you look at it in its totality, there's been a good coordinated effort to deal with this pandemic?
It is actually the odd case out across the world. It's the only region in the world that has coordinated its responses. Because what has happened with the crisis is that we have seen countries receding back to their space. They've become more nationalistic, more inward since January, late January. And all the structures of cooperation, of multilateralism, of regionalism, of globalism are weakened very significantly right now. Besides just what Trump and a few other leaders are doing to further weaken the World Health Organization at a time when we need it. Africa is the only region where they've maintained the modicum of regional cooperation, coordinating things, sharing lessons, sharing facilities, and trying to work together. It's the only continental CDC we have. Is the African one, and it has worked, and it is dead. We just want hope that they will maintain this to the end, so that history will validate Africa's approach, one of cooperation rather than isolation, one of working with others rather than just simply taking care of your own situation, because no country can say that it got the bulk of its infection from local transmission. Everybody got transmission coming from elsewhere, from all over. And therefore, responses have got to recognize that. And that when we respond, we must respond in tandem with others, because isolationism, ultranationalism will not help in dealing with a cross-national challenge.